you don't urinate plenty, or when you urinate small and then it's like yellow, concentrated. So the kidney makes sure that you are not over-flooded in your body, and make sure that you are also not dehydrated. So it balances the fluid in the
system.
And I'm just trying to link it to when there's a problem with the kidney. I just want people to understand. So it means that if there's a problem with the kidney, it will not be able to balance this
balance in the system.
So the water you drink, because the kidney is not able to filter it well, it can't come out much. So you can see some of them, as a certain point, may not be able to urinate much because the kidney is not able to filter much of the water. So what happens? Like we said, water will always find its way. If we pour water here, we close everything, it will find its way. So once it's not coming out, what happens? It will find its way into the body. So that is when it starts going anywhere, any space it finds. So it will get under the skin. Then they said the legs are swollen because the water has found its way under there.
And water will always find its way.
Water will always find its way. And then it can come, so you can see the hands can be swollen, around the face can be swollen. That's what happens. So that's the first function of the kidney. The second one, we say electrolyte balance. So when we take our food and all the things we take, so you have electrolyte, potassium, sodium, and the rest. The kidney makes sure that the appropriate amount that is needed for the body is kept. So if the kidney is also not functioning well, then it means that there will be problem with this electrolyte. So your potassium can be very high in the blood. Now we need to use medications or dialysis to bring it down.
Wow, and that is what that is what the problem is at the moment. And that's going to be the center of our conversation today.
We'll get there.
That's right.
Yes. Then the other one is that the kidney also regulates our blood pressure. So it produces some hormones that help to keep our blood pressures well regulated. So sometimes when the kidney is not functioning, we realize that they say the BPs have gone high. Especially if you see a young person, we are not expecting. We know that's what BP there as you are growing. But if you see someone who's 20 years, 25 with high blood pressure, some of them is because the kidney is not functioning. So the kidney can cause hypertension. Call it secondary hypertension. Then it also produces a very important hormone called erythropoietin. This hormone, it stimulates the bone marrow. When you are chewing the chicken, the bone, when you break, you see there's something brown in there. That's the bone marrow. So this hormone stimulates that bone marrow to produce the red blood cells. Our blood is made out of cells. One of them is the red blood cells. And so if your kidney is not functioning well, it means that this process will not be going on very well. So your blood level will go down. That's what we call anemia. You become anemic. Yes. So your blood level will go down because the kidney is not able to produce this hormone very well. Right. So it also regulates what we call the calcium and calcium homeostasis. So it makes your bone, helps your bones to be strong and all of that. So if your kidney is not functioning well, then you can have problems with your calcium. Sometimes the bones can be brittle, pain, and can even break something. Yes. So
it's a very special organ that from time to time we need to make sure that it is in a very good condition. Now, I understand, kidney problems in our country is really shooting higher and higher by the day. Do we have the data for that? Can you help us know so far?
Yes. So far we've realized, like you said, that there's an increasing trend. And the trend we are seeing, we see, when we were growing up, when we were training as doctors, those days when you see someone with kidney disease, they are older people. But the trend recently is that we are seeing increasingly more younger people coming with kidney disease
problems. The ages, if you can help us, the ages.
So we see people with, when we say chronic kidney disease, we see people like even 25, 45. Those are, we did the study and we realized that the productive age group has the highest number of people with kidney disease.
Between 25 and 40.
And 45.
Here in Ghana.
Yes.
And this bracket, we have quite a number of them. Wow, with kidney problems, chronic kidney problems.
Yes. among the people who are presenting to us, most of them are within this bracket.
Wow.
Yeah, which originally didn't used to be so. So we've been asking ourselves what could be the cause.
What is the cause?
You get so generally the causes of kidney disease worldwide. Okay, so let me just make some clarification. We have two different types of kidney disease. Okay. We have the one we call acute kidney injury. For acute kidney injury, almost anybody can get it. If you have any disease process, it can cause that one is reversible.
Okay.
You can reverse it back to normal.
Okay.
So for example, if you start having diarrhea, vomiting, you lose fluid. Like I tell you, kidney regulates fluid. So if you lose a lot of fluid and you don't replace it, the kidneys can shut down temporarily, but then once you get a drip or you replace the fluid, everything goes back to normal. So that's not what we are talking about. We have one that we call chronic kidney disease. That one is not reversible. It's progressive and ends up to what we call end-stage renal disease, where the kidneys cannot support you anymore, and that is when we need to intervene by doing either dialysis or kidney transplant. So for the chronic kidney disease, the main causes worldwide are uncontrolled hypertension, high blood pressure, and uncontrolled diabetes. These are the two major causes worldwide. In Ghana here, in our survey, we realized that hypertension is number one. In other countries, it's diabetes.
And we still find some of these things among the younger folks.
Yes,
because hypertension, we used to say hypertension, relating it to the older folks. But now you're telling me that 25, 40.
Exactly. So
what's happening?
So we are even seeing, as a physician in our clinics, we see a lot of younger people now coming with hypertension.
Stress?
Yeah, yes. And then we've noticed that it's more of lifestyle changes.
Okay.
We are not living like the Western world. Now people would rather go for fried rice, rather than those days when you can eat contomere and some
with your yam and your mushroom.
And mushroom.
Yeah.
Now everything is fast, especially in the cities. Life is so fast. You are always in a hurry. The stress levels, people are consuming a lot of alcohol, and the rest. No activity, you are in traffic for 2 hours.
Yeah.
The countryside is not much like that. So we've realized that our lifestyles have changed. People are not exercising because there's no time.
You don't have the time to do so.
There's no time to do that. You need to set out from home, and otherwise you
be stuck in traffic.
So people don't have time. So we realize lifestyle changes are increasing to that. So we think that's one of the causes. But you see, hypertension and diabetes are not the only causes. There are something we call chronic glomerulonephritis. Where you have some inflammation in the kidneys. Could be caused by so many things, infections and other things. So especially for children, when you are a child and you get sore throat, there are some special types of sore throat caused by what we call streptococcus, it's a bacteria. If you don't treat it well, it can cause some inflammation in the kidney. So as you are growing, then it can cause kidney disease. And we have chronic infections like HIV, schistosomiasis and other things. The chronic UTIs, urinary tract infections can also do that. Then we have some conditions we call connective tissue disease. So those who are this lupus, rheumatoid arthritis, and the rest. They could also cause.
They are all at risk when it comes to kidney problems.
Exactly, when it comes to kidney problems. But like we said, the three most important ones are the hypertension, diabetes, and the chronic.
From what you're just telling me, I don't know whether I'm right to say that mental health is somehow related to kidney problems, because if our stress level are that high and then it's contributing to this kidney problems that we're having, then mental health is another area that we should be taking critical look at.
It's true, and that's very important. We also see a lot of people, like you say, abusing drugs. And we think that, especially for the younger ones who don't have hypertension, diabetes, we think that could be a contributory factor. There are a lot of young men taking aphrodisiacs these days. And when it comes to that, what we realize is that you see people, they miss a lot of things. And now these days, when you hear the adverts for herbal medications, they have to ask something about your manhood. That way, and they know it excites the men a lot, so they will come and buy. But we see them missing a whole lot of things, and most of those herbs can affect the kidneys. So
these herbal medications that you're talking about, you find the advertisement on our screens.
Oh yes.
Are you speaking to fact, or these are just speculations?
So
you're a doctor, though.
Yes.
But are you speaking to fact? Because yesterday we had a conversations, and the FDA tells us that they have done their research, and there is no linkage, as far as about medication your kidney is concerned.
Wow, I would want to see that research, because you see, when we see the patients, we want to find out what caused your kidney problem, and we ask a lot of questions. Well, like this person doesn't have hypertension, diabetes, we screen for that, they don't have. But the only thing you find is that, I've been taking this herbal medicine for
wow.
this. And it's in literature. It should go on the net. There is a link. Nobody is saying, and it's not just herbal medication. Even some of our orthodox medicines, when you abuse some of them, it can cause it. So nobody should come and play the saint here. We are not here to please anybody. It is about
have you in any way had the conversations with the FDA as far as about medication approval is concerned, to let them know that these are some of the problems we are having, and for that matter, there should be some checks. Has there been any conversation of
we've not directly contacted them, but then I think we are trying to do some studies, have proof, and then we can engage.
We cannot wait.
Yes.
But with all that we've talked about, one other factor that or challenge that I want us to look at has to do with the healthcare.
Yeah.
Currently, when we talk about facility that deals or help with kidney problems in Ghana, what are the challenges we have?
All right. So I think a very important question, and the focus for this year's World Kidney Day, we are looking at equitable access to care.
Exactly.
And then safe medication.
That's right.
Now, that's very important. When it comes to kidney care, we have only a few specialized centers in Ghana. Although generally, we've trained physician specialists could manage it to a point.
Okay.
But we all know that when it comes to kidney care, it gets to a point where we need to intervene, either doing dialysis or kidney transplant.
That's right.
Now, when it comes to dialysis, the last survey we did, we have 16 regions in Ghana. We only have dialysis centers in 10 regions out of the 16.
The last survey you did, yes. Because the last one I checked, we had that of Greater Accra and that of Ashanti region.
We've gone beyond that. We've gone beyond that. Now we have dialysis centers in about 16 regions, 10 regions out of the 16.
Out of the 16.
But apart from Greater Accra and Konvanochi, and then Ashanti region, most of them have just maybe one center in the whole region.
And if it's functioning properly, that's another question.
So that is gross inadequate. Inadequate. For example, when you go to Volta region, it's only the whole teaching hospital that we can think about now. Okay. When you go to Ashanti region, Central region, and talk about the Interbetin. But when you, fortunately in Accra, we have a lot of centers. In the government sector, we have quite a number, and then a lot of private centers, because it has to do with affordability. So when you go outside Accra, and how many people can afford?
I'm only crying for those within these 6 regions that do not have the centers.
So most of them have to be referred to the nearby regions, which is not the best. It's not the best, and so we will need to get the stakeholders, being government, Ministry of Health, to see how we can extend these facilities.
What do you think is causing this lack of facilities in our country? Is it that the government isn't, prioritizing kidney, or it's too expensive for us to go in for? What do you think is the problem? Because it's something that should be a matter of concern to us, but it seems not. Why?
Yes, so it's expensive, but not too expensive for us to invest in, because this is about human lives. And the truth is that no matter how much money you have, you could find yourself in one of those regions and you have an emergency, and you can be in trouble. So don't think that was me, I'm in Accra, so at least when it happens, I'm safe. No. Even in Accra, the facilities you have is not even enough for those in Accra.
Okay. Comparatively.
So, comparatively. So, yes, it's expensive. A dialysis machine could go about $25,000 US dollars for one. But there are cheaper ones. When you go to China, you get cheaper ones.
Are they
I'm talking about the high end.
Are they durable?
They are. Why not? You can use them. You can. It's better.
So do you think the government isn't prioritizing?
So I want to say that last year there was a lot of hula baloo about kidney dialysis when Korleytey Baah had to close down because we didn't have enough money to operate because they were not paying realistic prices. And of course, the government hospital, so you cannot increase prices without parliamentary approval. So what we were charging was not enough to purchase. Because the dollar went up.
Okay.
Because we had an agreement with some people. They will tell you, okay, you are buying the thing as $3. But you see, those maybe 10 years ago when we started the agreement, $3 was about 6 cedis. Am I right?
Well, let's assume that it was about 3.
Right now, the same $3 will be about 3 times 30.
That's right.
Which is more.
That's right.
So it's like the amount of money you need to pay for the same amount you were paying 10 years ago
has shot up by so much percentage.
Exactly. And I think that is the problem. So the government came in and there are a lot of discussions going on.
You've still not come to a conclusion to that one?
No, I mean in terms of trying to work out a whole comprehensive clinic for the whole country, not just to sort out Korleytey Baah.
Okay.
So I think there are a lot of discussions going on.
But currently, let's look at costs.
Yes.
Because it's one of the factors that this year's World Kidney Day seems to be looking
exactly.
at. So somebody was on my show and then was quoting something around 700 cedis per section for dialysis.
Yes.
I don't know the reality. You are coming from Korleytey Baah and that's your unit. So help us know.
Yes, so the cost of dialysis varies, of course. You have private...
Let's look at the public sector for now.
So in the public sector, all right, so I can do for Korleytey Baah for now.
That's okay. Does it vary from region to region? From facility to facility?
Yeah,
or you have a flat rate?
No, it varies from facility to facility.
Whoa.
And you see, even in some of the government hospitals, there are private operators in there. So it's like a PPP. So it is not standard.
Okay.
Yeah, so for Korleytey Baah, we are charging $350 and per session. And it went up, but then there was a lot of, so we had to, the government said you should bring it back to that. That is even subsidized.
It went up to what? You've not quoted the amount that it went up to.
No, but those days we went to 500 and there were a lot
of now,
issues.
How much are you charging?
So the $350 for now.
It's still $350.
Yes, but then I think now Parliament has decided to give us a new figure, but we are here to, they said they are going to approve a new figure for us, so we are waiting for that one. But this one is a subsidized one. So when you go outside, some people are charging 500. Like I said, some people charge even up to like 700 cedi per session.
Okay.
And we're supposed to do ideally 3 sessions in a week. So the kidney functions 24 hours a day. 7 days a week. So what the dialysis is just a simulation. It's just of some of the functions of the kidney. What the dialysis that is like an artificial kidney, but doesn't do all the functions of the kidney. But some important ones like the filtration. So it takes excess fluid. Like I told you, once the kidneys are not functioning well, you as a human, by almost you drink water, you eat. So the excess and the waste products, the machine takes it out. So it's like your blood goes into the artificial kidney machine. It washes it in quote, takes all the dirt, excess water out. Then the clean blood comes back into you.
Are we right to use the word filters?
Yes.
Okay.
So that is what it does. But this thing that is done 24 hours a day, we try to do it. You can like 4 hours. 3 times a week.
Wow. So that's like 16 hours out of the 24 hours.
Times 7. You get it. So it's not adequate, but that is how much we can do. So but there are some people who cannot even afford the 3 times a week. So some do like 2 times a week. There are people who can even go like once a week because of money. It's not because that's the ideal. And trust me, how many people in the working class can afford this? Let's say you're even paying 500 cedi per session and you're doing 3 times a day. That's 1,500 a week. So in a month, you are doing like 6,000. Is that not so?
It's so.
And you are not going to also buy medication, your BP medication, sugar, and other specific medications,
which are quite expensive as well.
Also expensive.
So some people were arguing or saying that why don't we try to let the health insurance cover it? I don't know what we've got into with respect to that conversation. So
yes.
If you can help me once you're in the studio, what are the latest on that?
That's an interesting one, but yes, it's been part of the discussion. But in fact, last year when the issues came, that was one of the suggestions that they should allow National Health Insurance to cover it.
Yeah.
But then they said they are looking into it.
Okay.
It's all about cost.
Okay.
And whether the insurance will be able to absorb that. Don't forget the amount is substantial, and so they are working on it to see if it's possible. But aside that, we need to look at other alternative financing mechanisms.
That's fine. So we've come to that one, and then we'll look at the transplant itself, because we're hearing that you are putting down some policies with respect to the transplant. So we'll come to that one. But okay, so we had wanted to go speak with Mr. Ahinkra on the line, who is a victim, to help us know what he has been going through as far as the dialysis and then other issues seems to be concerned. But let's come back to you, because I understand we're struggling to get him on the line. So let's look at that. You were talking about the NHIS thing.
Yes.
And then other.
So yes, I'm sure they can work it out and see if the NHS can absorb. But with the current challenges, I know it's going to be challenging.
It's going to be a bit difficult, right?
I think as a country, we need to look at alternative sources of funding.
What would you suggest?
So, one, I think we should try and bring private health insurances on board. We have the capacity. So that is encouraging people to register some of these private health insurances. They should have the capacity to cover, so that they be able to pay for some people.
Okay.
And that will take some burden off government.
Okay.
We're also thinking, for example, the COVID levy. The COVID levy has done a lot. Now COVID is not a major problem like it used to be.
But we're still paying it.
Yeah, we are still paying it.
That's right.
Can we convert a percentage of the COVID levy into a national kidney fund, which can help sustain? Because you see, let me tell you, the reason why dialysis is expensive is because of the consumables. You see, I don't know if you've seen the picture of the dialysis machine.
If you can get a dialysis machine on our screens this morning for those who, okay, so they are doing their very best.
If you look at it, anytime they come, they're artificial. You see, the machine is there, but we have the filter. Those are the tubes. Those are anytime we do it, we have to discard them.
Is the externals that's a challenge.
And all those things we import them with us. There are some places where they are able to sterilize them, so they can use the same set maybe 2 or 3 times for one person.
Okay.
That can reduce cost.
Okay.
So if we have those special sterilizers, we can reduce cost. Then the machine is very expensive.
Okay.
But it comes like we get it from people through a contract. And so they can give you the machine, but they say buy the consumables from us. And that is what makes it expensive, because now they will give it to you at their term. But if government can invest in the machines, so for me, if the percentage of the COVID levy is put aside and we're able to purchase or procure dialysis machines ourselves, we can go to the open market, buy the consumables at cheaper prices, and that will reduce the cost.
Have you suggested this to the policy makers? Because it sounds laudable.
Yes.
Maybe other units are asking why kidney alone, because we still have other conditions that are quite pressing that we need also be looking at. But I don't know whether you suggested, and when you did, what was the response?
Well, so when we were having the discussions, those were some of the suggestions we put forward, and we don't know how far.
Does it sound laudable to them?
I think so. I think so.
Do you see us getting there someday? You know?
Yes, I see us, and I think that the policymakers should really look into this. Let's get this thing out.
Okay.
That is my suggestion.
Okay.
That we should convert a portion of the COVID levy into a national kidney fund.
Okay.
Procure machines let's get to the open market, buy our own consumables, and I think it's going to bring the cost. Let's get some sterilizers, and this will bring the cost of dialysis down. This is my proposal.
Your proposal.
It is not by the unit, and so we can discuss it.
But I'm sure some people in the unit you've been having this conversation, just that it is not official.
Yeah.
But I know that the new health minister, Dr. Okoboy, you were watching us. Of course, we'll be coming to you as well for some response. What is it that we can all do to ensure that, you know, we've improved, you know, our infrastructure when it comes to kidney issues? It's quite a challenge. It's quite a challenge, and it's about time we look at it critically. You understand that? Now let's come to the transplant. Let's come to the transplant. We're still trying to get Mr. Ayinkra on the line to speak to him. He's a victim, and then with this that you're outlining, we find out how many times is he able to go for his dialysis. So the transplant, Ghana, is it that common? Are people donating their kidneys?
All right. So just for the sake of our listeners, let's explain what the transplant is.
Beautiful.
So when we say kidney transplant, all we are saying is that for you to go on dialysis, it means all the 2 kidneys are gone, are destroyed.
Okay.
In fact, everybody can live on 1 kidney. Okay. God has been so good to us. You can live on 1 kidney. So for you to see that your kidney is where your kidney function is deteriorating, then it means that 2 kidneys are all gone.
Okay.
So what we do is that because everybody can live on 1 kidney, we ask people to donate 1 kidney to the other. So that's what we do.
Okay.
We get 1 kidney from a healthy person, give it to this person, and that person can live his life.
It sounds easy, but not so common.
Not so. So we have 2 types of transplant.
Okay.
We have what we call the living donor transplant, and then cadaveric transplant. When I say cadaver is dead person, almost dying. So maybe people get serious accidents,
we realize that they
cannot save them. We can harvest their kidneys and give it to somebody. So in the outside in the Western world, there is a whole program that is for harvesting kidneys. So when people are brain dead, then we can harvest their kidneys, and then we save it, and then we give it to people who have. And it's not only kidneys, liver, pancreas, and the rest.
That's right.
And in Ghana, we have not started cadaveric transplant because that comes with a lot of legislation. And we are engaging Parliament on that. But then we are doing the living donor transplant, but it must be a related donor. It must be your relative. Because you see, we have to be careful not to encourage
else it becomes a business.
It becomes
where people can just go, you know,
organ harvesting.
That's right. Organ trafficking.
Organ trafficking.
That's right.
Because you know people are so poor in the country. You can go and offer somebody 10,000, 20,000 Ghana cedi, and
then the person will just give it.
So we have a whole ethical board that must establish that the person who is coming to donate for you is doing it willingly, not out of any financial reward, and is related to you. Before you be accepted for the transplant. And I must say that we've started transplant in Ghana about 10 years ago.
How successful has it been?
It's been quite successful compared to other places. We've had very comparable results in terms of survival. And we started in Kolibu Teaching Hospital. We've been doing transplant. Even last year, we did transplant. In fact, early this year, we even did another 2 sets. I must say that, fortunately, last year we had UGMC also started, and then the Bank Hospital also did a few.
Wow!
So it's becoming increasingly accessible, and we are hoping that we will put structures in place to make sure other centers can also start. It's the best treatment for kidney disease. Once you get a transplant, you are almost back to normal.
Wow!
So it's a program we need to invest in. And make sure. But once we get the cadaveric, it even makes it easier.
All right. We'll come to some few policies, I mean, with respect to this transplant thing, and then we can move on. But today being the World Kidney Kidney Day. We've talked a lot about the factors that contribute to kidney problems. We've also dealt with the infrastructure. We've dealt with education. Awareness is very much important. Of course, that is what we are doing here this morning. But let's come in with symptoms. I mean, while listening to us, maybe we have it, but we do not know that is a kidney challenge. So in a minute or two, if you can throw light on it, I mean, how would you know that you're having a kidney problem?
Yes, so I think that when I was talking about the functions, I tried to bring in some
a little
of them.
On that, exactly.
Interestingly, you see, we have stages of chronic kidney disease. So we have stage 1 to stage 5. The stage 1, so we have what we call the estimated glomerular filtration rate, where we measure let's say the percentage of your function of your kidney.
Okay.
By the stage 5, it means that it's less than 15.
Okay.
And so it cannot sustain you. That's when we come in with either dialysis or transplant. Interesting, from the stage 1 to stage 3, you will actually not feel anything. That's the dangerous part. And the early stages are when you can intervene. So until you go and check, you may not know. So people who are high risk, we suggest that you do regular checks every year.
Those who are high risk?
Yes. Maybe you have hypertension, diabetes, or any of those.
So that possibility of having a kidney issue is very high.
Or your age is over 40, you should be able to, at least every year, you should be able to. Now, it's so simple. Just a urine test and a blood test. And the scan may be enough for you.
To know the state of your kidney.
It will cost you up to 300 cedi. To know how well your kidney is.
And all other health facilities can do this for us.
Every health facility can do this for us. Just go and tell the person, I want to check my kidneys. They know what to do for you. All right. But most of the symptoms will come in the stage 4 and 5 when it gets to the end. So like I said, you may find that your legs are getting swollen because of all the explanation I gave. But please, it doesn't mean that if your legs are swollen, then you have kidney disease. There are other things that can get your legs swollen. So please don't get worried. I'm just saying it's one of the things that can get your legs swollen. Sometimes, like I said, you find out that your blood level has come down. We are investigating, then we find out. Sometimes we find out that your BP is high. Maybe for a young person whose BP is high, it will get us to start finding out why your BP is that high. But generally speaking, because of the waste products in the body, you may be feeling unwell, like feel like vomiting, what we call nausea. You actually be vomiting, feel unwell. Those are non-specific things. So basically, those are some of the things.
Symptoms, alright.
Those are some of the symptoms.
So when you see them,
if you become so worse, like I told you, the water, the fluid, once it's not coming out, it will definitely find its way in the body. So also the legs swelling and the things they come, but when it gets into the lungs, then it becomes more dangerous. Then they cannot breathe well. That's why we need to do dialysis urgently to get the excess fluid out. So when it can get into the heart, into the lungs, and then you can't breathe well, you can have sometimes around the lining of the heart some fluid there, and sometimes it can be so worse that you can get confused and even collapse.
So we're in the studios with Dr. Winfred Baah, he's a consultant physician with Ghana Kidney Association. We've had an interesting conversation. Of course, we need to speak with the FDA again, because according to Dr. Winfred Baah, this herbal medications, it's a real problem. And he isn't running away from it. He says that we're not here to please anybody. The truth ought to be told. So we're going to delve deep into that. His words as against that of Mr. Afis's word, and then we find where we are. All right, and so let me get back to you, and then you look into our cameras. The Ministry of Health is watching. We're dealing with kidney today. We've talked about some of the things that you think ought to be done, but they are policymakers. They are policymakers. We've talked about accessibility. We've talked about treatment. We've talked about everything. Suggest some two strategies that you believe can help deal with our kidney problems here in Ghana to minimize the rate at which people are being infected.
Thank you very much. So like I said, number one, we need to invest in a good screening and prevention program. we should have a national screening policy for kidney disease. That will be incorporated into the health infrastructure, so that people, once they come to hospital, will have a system where they will be screened automatically. So somebody comes, so I want to just come in for maybe hernia surgery, we can do some quick things. Somebody is coming for heart problem, we can do some quick screen. So we need to have a very good screening program, because that is where you can just pick up somebody with protein in the urine, and when you intervene, you can prevent that person from developing chronic kidney disease in the future. So a good screening and prevention program is key, and we can look at that.
We don't have them as we speak.
Not a structured one.
That's okay.
Then number 2, we are talking about accessibility to care and affordability. I suggest that we should take a percentage of the COVID levy, establish a national kidney fund, buy machines on our own, get consumables from the open market, and that will reduce the cost of dialysis
in our country.
Then let's put up a sustainable program for kidney replacement therapy or kidney transplant. This, I think, will help manage the kidney problem in it. And I want this to go out, and let's discuss it further.
If as the beginning of the conversations, trust me, we started somewhere Monday, and with respect to the infrastructural development as far as kidney is concerned, we've just begun. So a lot more things will be coming up. Trust me, this is our first engagement. We're going to be engaging more. But as you said, part of the COVID fund should go into kidney, I mean, to save the situation we have at hand, especially with respect to equipment, you know, that works around the kidney issue. So the Ministry of Health, you're listening to me, will still be coming to you for answers on those one. It has been an interesting conversation, Dr. Winfred Baah. Thank you so much for passing through today.
Thank you so much for inviting me. I'm happy, and I want to tell everybody, today our team is in Tamale. This year we are doing it in Tamale. We are doing screening for people. But you can walk into any hospital, say, I want you to check if my kidneys are well.
That's right.
It won't cost you much.
It won't cost you much. All right, then. Thank you. So that has been our conversations for today in the studios as well. Dr. Winfred Baah, a physician consultant from Ghana Kidney Association. He has been very, very educative.